I think this pandemic has had both positive and negative influence on how we practice medicine and how we practice cancer care. The positive effect of this pandemic is that we have become more aware of patient comfort. We have become more aware of the technologies that were already at our disposal to make patients' journey with cancer care more comfortable, in the sense that we are not bringing patients to the clinic as much as we can in order to avoid their exposure to possible COVID-19 infection, but that is actually helping the patients because they are getting care from their home with the help of e-medicine or telemedicine, and they don't need to travel a long distance just to show the just to know what the CT scan results are, for example, or just to be told that, oh, everything is fine, come back in 3 months. So these are some very positive changes that we are making out of necessity because of the pandemic. But now you'd feel like, oh, why didn't we do this before? And I hope that we continue to do this even after the pandemic is over, to make patients' life as comfortable as possible. And the other important thing is that we have become more aware of low-value practices. So we are not recommending any low-value treatments to patients that would necessitate the patient to have more exposure to the healthcare system. So we are becoming more aware in terms of setting priorities. Is this treatment really helping with patient survival? Is this patient really going to make such a difference that it's worth exposing the patient to the hospital system, where the patient can get can get COVID-19 infection, and so the risk-benefit trade-off has changed. For example, my colleagues, I have seen that they have stopped recommending low-value drugs, like say regorafenib, for example, because the benefit is minimal, and they are worried that when I recommend this drug to the patient may end up in emergency, in this situation where you would not want to go to emergency unless it's absolutely essential. So this awareness of low-value practices out of necessity has emerged in high-income countries because of the pandemic, which is one of the positive influence this disease has forced upon us. But I guess we continue to keep this lesson up, and as I had mentioned in one of my columns I wrote a week or so ago about learning from low and middle income countries, because the low and middle income countries have always been in a resource constrained situations, and they have learned how to prioritize things, how to innovate things, the concept we call frugal innovation, or in our language we call it jugaad. So now high income countries, out of necessity, we are all resource constrained. Nobody is resourceful now, so we need to think in those terms that low and middle income countries have been thinking about since a long time. So these are some of the positive influence that I have noticed. But the negative influence is, of course, that, and it's not related to cancer care, but the treatment of, or the prevention or the treatment of COVID itself, where the principles of evidence-based medicine have been abandoned out of the necessity and the fear of the disease, which I totally understand. There is a huge fear, or almost a panic, of COVID-19 infection, and the threshold has changed, which I understand. The threshold for asking evidence for using a certain drug in order to treat patients with COVID-19 infection, but the problem is, as I mentioned in some of my tweets, that we have replaced evidence-based medicine with hearsay-based medicine, EBM with SBM. The problem is that we can see data coming from hundreds and hundreds of patients who have been treated with, say, hydroxychloroquine or hydroxychloroquine plus azithromycin. So if we have this data coming from 500 patients, then we could have easily randomized these patients to hydroxychloroquine arm and a best supportive care arm, and we could have easily found the answer to the question: does hydroxychloroquine or hydroxychloroquine plus azithromycin actually work for patients with COVID-19 infection? Because we did not randomize, because all we hear is anecdotes. Uh, we don't know the answer. So, and this is such a big deal. I would say that in times of pandemic, it is more important to have evidence-based medicine than at other times, because now thousands of lives are at stake. And when thousands of lives are at stake, you definitely want to know. Like all the healthcare systems are confused. Even low and middle income countries, everybody is hoarding chloroquine. Everybody wants a supply of chloroquine, when we don't even know whether chloroquine is going to save these patients or not. And the problem is that if these drugs are not going to save the patients, then we're wasting our resources, our efforts in just trying to have access to these drugs and giving these drugs to the patients. And we have also seen reports of some side effects from these drugs. Obviously, hydroxychloroquine has been used since a long time for malaria prevention as well as treatment, as well as in a number of other inflammatory diseases. And there are concerns about patients with these inflammatory diseases not having access to the drugs, because of this problem of everybody hoarding the drug, thinking it's going to be super effective. But all those problems aside, the fundamental issue I see is that we don't know whether this drug is going to work or not. And that's the fundamental question we should answer first. And that's a question that can be easily answered by randomization. And if we have answer to that question, then we know whether it is wise to spend huge amount of effort and resources in producing these drugs, increase the production, increase the manufacturing, increase the transport, and have access to these drugs as soon as possible, or not. I think it is very important to have answer to these questions in a quickly fashion. And I really want to applaud and praise all the investigators and people who are working on this regard, because I know by speaking with my friends from various countries that splendid efforts are being done. A trial is being run in 10 days, starting from writing the protocol to actually running the trial in 10 days. These are things that we never even imagined were possible. So this also shows that most of the red tape in conducting trials is actually unnecessary. We're actually increasing the complexity of trials, increasing the cost of trials. Because this pandemic, or one of the silver lining of the pandemics, is that it showed us that we could run a trial efficiently in a short amount of time, and most of the red tapes were. We need to look back, like what are the things that are actually protecting patients, and what are the things that are actually just increasing complexity without protecting the patients, and we could get away with all those red tape. So the WHO is taking a great initiative in launching these trials. So I really look forward to the results from those randomized controlled trials. But currently, as of now, as of our recording of this video, what I see everywhere is evidence-free medicine instead of evidence-based medicine for treatment of COVID-19. Although emotionally, I can understand the feeling and the rationale behind it, but it's definitely not scientific. And if you think in terms of the long term, and if we think in terms of the whole patient population that is going to be infected with COVID-19, then we're actually we would actually be doing them a huge amount of service if we generate proper evidence and treat in the evidence-based fashion rather than just treating based on anecdotes. Of course, these are difficult times, and all of us are uncertain and not sure about what's going to happen next. But talking about silver linings, this is also a time where we can find where we are able to see so many positive things that are happening around the world. The the courage and the efforts of the healthcare workers who are working in the front line with the COVID-19 infected patients. That's exemplary. That's like no words can do them justice. They are sacrificing their lives, their families in order to provide care for the patients. And these are scenes that you get to see once in a lifetime, maybe. Uh, and rightly, all over social media, they are called superheroes, and I couldn't agree more. Uh, and we have also seen colleagues working together uh, from across the world, and there is no geographical boundary here. People are working together, people are sharing their data together, people are learning from each other how colleagues are coping with this in one part of the world versus what we are doing in the other part of the world, and what we can learn from each other. People are sharing their experiences. This is also an opportunity to show the importance of global collaboration, networking, and most importantly, data sharing, open data, and the importance of getting the data out as soon as possible. I think we should make a commitment to continue with those good things even beyond the pandemic. Once the pandemic has settled down, we should continue to cherish these memories, and we should continue to make a promise to continue all the good things that we have been doing at this time of pandemic. So I guess there are a lot of positive things to look at if we know where and how to look at.